Michele Monserratt-Ramos is a state and national patient advocate who oversees the Kathy Olsen Patient Empowerment Project at Consumer Watchdog in Los Angeles. She entered advocacy work following the death of her husband-to-be after an elective surgery performed by a substance abusing doctor, and later experienced long-term care challenges while caring for her father with Lewy body dementia. So, Michele, with your experience getting bills passed in California, what concrete strategies can you share about effectively engaging legislators on long-term care issues? What motivates them to take action?
Thank you. Thank you for, it's an honor to be a part of this panel, and thank you for all of us for joining us here today. There's a couple things I want to talk about. It's important to engage in our families' long-term care, and advocacy plays a big role in this. We can advocate as a family before placement, during, our family members' time there, and afterwards. There are things that you can do before you consider placing your loved one in long-term care. You need to do your research. Look up who the medical director and the director of nursing is. Go to your medical board website and look up the provider's physician profile. You can find out certain information about them there, including if they have had prior disciplinary actions taken against their license. You can do the same exact action on the nursing board's website as well. Why is this important? When you place your precious family member in a long-term care, you want to know who's in charge of their care, but you don't want to stop there. You can do a Google search and search for the website similar to CalHealth Find. There you will find your state's Department of Public Health records for that long-term care facility. This will take you into a health facilities informational database. Within that database, you can search under the name of the long-term care facility, and it'll list any complaints filed against the facility during the past 4 years, including statement of deficiencies listed, which is a document that verifies that a family's complaint has been substantiated, and it will list errors such as bed sores, medication errors, falls, security issues, etc. It will also include the rare enforcement actions where the facility is fined by the state for violations. These are a few of the steps you can take to conduct some background research on the providers responsible for your family's care, and some background information on the type of problems that occur at the facility, which will give you a little idea of what type of care is provided. Now, if your family member has experienced poor care at a long-term care facility, or is tragically passed away under questionable circumstances, then you can file a complaint with your medical board or nursing board. They all have websites with consumer complaint forms located on those websites. The most important aspect of the consumer complaint is your actual written complaint. You want to identify specific situations where your family member's care fell below the standard of care. Finally, if we want real change in our long-term care facilities, then we need to engage in our healthcare. One way that we do this is through advocacy. The only way that we can make our long-term care facilities in general safer is through policy change and legislation. This is what my team has done. We started our legislative efforts by updating the microcap in California, which is the Medical Injury Compensation Reform Act. The microcap in California remained at $250,000 for 47 years with no change. The cap pertains to pain and suffering, which is a significant aspect of a lawsuit when a senior citizen passes away due to unsafe care. I built our team of advocates during this campaign with families representing just about every segment of the state. I organized informational campaigns in regions of the state where we had multiple losses. Our goal was to update the cap, but it was also to increase transparency and accountability in our long-term system in order to save other families. We met with legislators across the state. As our team grew, we were able to mentor our advocates into community leaders in their districts. Our advocates began to build relationships with their legislators. We attended meetings with them and helped them build their advocacy skills. They began to attend regulatory board meetings with me, where we testified as a unified voice to move issues that were important to the public. We pushed our legislative priorities, which led us to the legislature, where we testified before our legislative committees to help move our bills. We didn't stop there. Most of the work is done in between hearings. I wrote scripts for our team, and we emailed legislative committee members before committee hearings and worked the phones to gain votes to support our bills. We did our research, our outreach from one house to the other until our legislation reached the governor's desk. What ultimately moves legislators are their constituents' stories, our family stories. They have parents and families also. They want to know if the long-term care facilities are safe for their families and their constituents. If you do much of the work for them, their staff, they'll be willing to author legislation to make long-term care in their district safer for their family and others. Within our advocacy, we are starting to see our results pay off for new families. They now have rights that we did not have. More changes are being made, which means more transparency, more accountability, and more lives saved. Thank you.
Thank you, Michelle, and for the work that you've done.